Hello, how's it going? Um, it's been a little bit of time. I've been busy. Let's see. I've been looking into what's going on in Cuba as far as their jabba mandate, or it's maybe a mandate, but just the status on their jabs and what's going on out there. And a recent article that was brought to my attention on Twitter of some modern day slavery um, in Georgia by some farmers that are migrants. And this is nothing new, but I'll go to that story. So I'm going to try to keep this stream pretty short. But let's see, I always say that, and it turns out to be like an hour stream. So if you're joining me, thank you and welcome. This is the Apocalypse stream. Let me get right into it. Well, first, let me figure out what tab I need to show. Let me start with, I guess, some journalist, Walter Bragman. He had this post, and this is what kind of made me get through a spiral on this topic. And also, I've been covering and talking about Cuba and COVID recently, or for many streams. This is my first stream about how Cuba has handled COVID and its manufacturing of vaccines. I think if you've been watching my streams, you know that I'm not anti-vax in any way, but I am a little hesitant on this vaccine that's been speeded out, the Pfizer's, the Moderna's, all this. So I've gotten all my shots in the past, gotten the tetanus, all that crap. But yeah, this isn't anti-vax at all. Okay, so this post is from let's see, I don't even know what day it is, to be quite honest. It's December 9th. So this was last week I started putting this together. Let's watch this video. But this is posted by Walter Bragman. I'll read his little response after this. Play. You should be able to hear this. Let me know if the volume is bad. I'm going to mute myself.
The game to bring something that saves lives, that saves money. There is also financial reward. We didn't do it for that, but I think it's a good thing. I don't know for sure how long the third dose, the booster dose, will last. I'm very confident that it would last at least 12 months, but I don't know that. If we have to make a guess, based on everything I have seen so far, I would say that likely will be needed annual revaccinations to maintain very robust and very, very high level of protection. I believe that we have saved the global economy trillions of dollars. I think it's a strong incentive for innovation for the next pandemic, that people will see that if they stepped up to the game to bring something that saves lives, that saves money, there is also financial reward. We didn't do it for that, but I think it's a good thing. I don't know for sure.
Hey, Lisbones. How's it going? Sorry, I was on mute. And thanks for calling that out. So, man, I don't even know how much of this I was muted for. Was this whole time muted? I have no idea. But basically, uh, it's been a long time since I've streamed, probably about 2 weeks. So I'm a little bit rusty. But basically, what I'm going on is I shared. Are you staying on for a bit more? Yeah, I'm going to stay on for a bit more. I just started. So I'm talking about some updates to Cuba and its jab situation. I've shared this hot topic, this hot term called vaccine apartheid, and shitlibs like Walter Bragman kind of asking DSA people, saying that even the Green Party, I don't know if anyone heard that if or I was on mute by accident, but there's a lot of these people that are asking for companies such as Pfizer to um, waive the patents so we can vaccinate the global south and all the poor countries. And this is where I bring in Cuba. Cuba has its own vaccine, right? Um, so the United States is trying to donate Western vaccines to Cuba, and Cuba has already vaccinated pretty much its whole population, and it's already issuing out booster programs. Cuba has vaccinated, not only the adult population but also kids and things like that with their vaccine, um, with two of the vaccine candidates. But okay, so they are offering vaccines to already vaccinated population, even when the booster dose program is advancing. But they also pose strict and interventionist requirements, such as the obligation to carry out clinical studies in Cuba with these vaccines, said the minister. So these Western companies like Pfizer, Moderna, Johnson & Johnson, whoever's donating these vaccines wants to obviously carry out some clinical trials. So we'll give you some vaccines, Cuba, but we're going to test on you. Cuban authorities replied respectfully, Rodriguez said, explaining why the donation would not contribute to improving the health of Cubans. He did not mention which specific vaccine the U.S. government intended to provide. Cuba is the only country in the region that chose not to. Okay. So, American officials, Rodriguez continued, mentioned international mechanisms that so far have been inefficient and discriminatory, a remark that seems to refer to COVAX, a program managed by the World Health Organization to provide vaccines donated or offered at lower prices to developing nations. Cuba is the only country in the region that chose not to participate in the program. Instead, it decided to develop its own vaccines. The government is currently in talks with the WHO to get emergency authorization so it can sell its vaccine through the organization. According to official data, 70% of the island's population has been vaccinated and is fully immunized. That figure also includes children as young as 2. Okay. So a little bit more. So let me go to a different article. So basically, the United States is trying to donate some vaccines to Cuba. Cuba says, no, we have our own vaccines, and plus it's too late. Why are you giving us vaccines? We already developed our own. 5 different candidates. So let me now share a different article here. Cuba's homegrown Coco-19 vaccines poised to protect millions in poor nations. So people like Walter Bragman, DSA, Green Party, all talking about vaccine apartheid, don't understand that the socialist government of Cuba has been providing vaccines, its own vaccines, to people who these Western um, multinational biopharmaceutical corporations aren't interested in really serving. Um, Cuba's home Cuba's homegrown COVID-19 jabs poised to protect millions in poor nations as rich countries hoard doses and big pharma refuses to share knowledge required to ramp up manufacturing. Cuba's public biotech sector could play a key role in defeating vaccine apartheid. Despite the added challenges created by a 6 decade long US blockade, Cuba's public biotech sector has developed two highly effective vaccines, and its universal healthcare system has inoculated four-fifths of its population. Cuba is now one of the few lower income countries to not only vaccinate a majority of its population, but also one that has done so with a vaccine it's developed on its own. So more about its inoculation rates. 90% of Cubans have received at least one dose. It's a lot. This is all about stuff I've touched on about in the past. Because of the embargo, what is causing Cuba to struggle and probably vaccinating more people and manufacturing more of its vaccines is the blockade. It can't get the materials it needs to manufacture more and to inoculate more of its population because of the shortage of syringes. Um, you know, solidarity groups from the United States sent 6 million syringes to Cuba. Mexican government sending 800,000, and China even sending syringes to them. So here's more data on what is this? Total number of people who received all doses prescribed. This is not related. Okay, not related. Go to the next article here. Cuba, COVID, cocoa, and vaccine equity with post. Basically, what's been happening. This is an article I read to get what I'm about to say, but let me just paraphrase it because I do want to get off. I'm not feeling really in the mood to stream, to be honest, today. But I've been sitting on this information and I want to share. But what's been going on is this buzzword, vaccine apartheid. Now, Cuba has its own vaccine. It's sending its vaccine to other countries such as Vietnam, Nicaragua, let me see, Nigeria, Venezuela. Basically, it's exporting its own vaccine. And there's this word, vaccine apartheid, that's been thrown around a lot, but it's talking about Western companies. And Cubans have created a very, very highly effective vaccine, and it's exporting it. And it's trying to get it approved by the World Health Organization, and it's not. They refuse, or they're taking too long to to approve of the vaccine. Now it's approved all the Pfizer ones really quickly, all of the Moderna ones, all the Johnson and Johnson ones very quickly. I think even the Chinese Simovax or something like that, I think is what it's called. These are all approved, but the ones that aren't approved are the ones created by Cuba, I believe also Russia, and they have data to support that it's very effective. Let me go to this article. This one, I have so many, um, so I'm lost. It's really hard to structure a conversation when there's so much information. But the Western world, this is on the conversation.com. Cuba's COVID vaccines, the limited data available suggests they're highly effective. The Western world has written plenty about its high-profile COVID vaccines, the mRNA products, but not Cuba. Many countries are relying on these vaccines, but not Cuba. It's been quietly working on its own vaccines, immunizing its population and selling doses abroad. Not even just selling its doses, but also trading um, like food because of the blockade. And I'll share an article that I found about Cuba trading food for its own vaccines to a African country. Cuba's vaccine efforts have maintained a relatively low profile to the West to date. Politics may be a reason. The U.S. embargo against Cuba that began in the Cold War is still in effect, and tensions between the countries remain high. The country has a long history of manufacturing its own vaccines and medicines. Nor should it be surprised that two of its COVID vaccines, Abdallah and Sobrania dos, appear to have performed very well in trials. Here's how they work. Abdallah is a protein subunit vaccine, which is a well-established design. The hepatitis B vaccine and Novavax COVID vaccine use this approach. Now, the other one, the more popular one in Cuba, the Sobrania dos uses a conjugate design along the lines of meningitis or typhoid vaccines. It contains different parts of the spike protein to Abdallah. He generates a immune response by attacking. Okay, I'm not going to really read this, but that's how it's working. It's non-mRNA that they developed. How effective are they? Both vaccines have been approved by the Cuban regulator though they started being rolling out in May before authorization. So even in Cuba, they had an emergency use authorization to roll these out, but since then have been approved by the Cuban government. On November 1st, 2021, a preprint, here's the link to that, research still awaiting review, was finally published. Sobrania phase 3 trial that included 44,000 participants. The results suggest that 2 doses of Sobrania Dosi with a booster of Sobrania Plus are together 92% protective against symptomatic COVID. Who should use a Cuban vaccine? Given the difficult relationship between Cuba and the US, the market for the Cuban vaccines, it will probably be its political allies. Vietnam and Venezuela are reported to have received Abdallah doses. Nicaragua has given emergency authorization to both vaccines, and doses have been previously sent to Iran for use in clinical trials. I reported on Cuba sending its vaccine recipe to Iran to mass produce this. So because of the embargo and Cuba only being able to, on its own, produce around 100 million doses of vaccination for its own vaccines, is sharing the formula with Iran, who has the manufacturing capability to produce more. Um, so, you know, people talk about, again, people, this is why I want to talk about this, but people keep talking about vaccine apartheid, and that's only a thing in the capitalist side of the world. Uh, and we know who doesn't want to release the patents because there's money to be lost. The socialist government of Cuba created vaccines to be shared for public health, um, and put aside, you know, a mandate issue and all that stuff. This is strictly about um, people coming together for health, and the socialist government putting its resources to help reduce symptoms of COVID, or help stop the spread of COVID. And in the global South, which includes Cuba, obviously, who has been embargoed for 60 years. Um, Mexico and Argentina are also interested in using these vaccines. Cuba has submitted both to the World Health Organization for approval, which would improve the likelihood of them being used abroad. If there are any plans to include them in the COVAX vaccine sharing initiative, then WHO approval is a must. So this COVAX vaccine sharing initiative, it's all of the biopharmaceutical companies who are on this list, and they are selling their doses at a discount or donating to poor countries. Now, Cuba wants to be on that list, but not for profit. They want to help solve the issue of COVID, but they're not getting approval. So is this really about profit, or is this about saving people and from the symptoms of this disease and stopping the spread of it? I don't know. I'm just some dude on YouTube. Given most richer countries are in the queue for Abdallah or Sobrania, thus it's entirely possible that in the future parts of South America, Asia, and Africa, where vaccine coverage is particularly low, may see Cuban vaccines in many arms. So basically everywhere that is unprofitable to go to will be seeing more Cuban vaccines because the Cubans are sharing their formula and selling its product to the people who need it, to the people where these corporations don't want to go. There's all these issues. But that's that. Now, I wanted to share a story where Cuba is actually sharing its vaccine for food, not even for money, just to feed its own people. So, allafrica.com, Uganda, Cuba to exchange COVID vaccines for Ugandan goods. Cuba to exchange COVID vaccines for Ugandan goods. President Yoweri Museveni has asked Cuba to identify the agricultural products that it needs from Uganda in exchange for COVID vaccines. Brief us on your needs in agricultural products so that we may sell to you. I agree that with you over the proposal of trade between Uganda and Cuba. Museveni asked his guest in response to the Cuban ambassador's proposal to have bartered trade between the two countries. So Cuba is not even trying to ask for money for its vaccine to provide to Uganda. It just wants food because of this embargo. So trade us food for vaccines. Help us feed our people, and we will help you combat this disease. I don't think it gets more socialist than that. The president made the call on Tuesday at State House in Debe, I don't know if I pronounced that right, during a farewell meeting with outgoing Cuban ambassador to Uganda, Antonio Luis Izguirre. So, Izguirre. Um, let's see. So, pretty interesting. I mean, give whatever you wanted about the vaccines. Cuba has been able to produce its own vaccine, uh, vaccinate its whole population, share its recipe with countries such as Iran to mass produce it for the global south. And we got people in DSA talking about vaccine apartheid, and that these Western companies should just waive their patents, waive their patents, so they don't make money. They're never going to do that, dude. No one's ever going to waive their patent. These things should have been, I mean, they were researched with public money. They should belong to the public, like they do in Cuba. Hey, Propaganda Live, what's going on? Thanks for joining. He's talking about Cuban vaccines and how the Cuban vaccine will be pretty much shared across the world to all of the poor nations, that the corporate Pfizer's and Moderna's don't really want to sell to, for reasons unknown. Because we want to stop the spread, but only if you pay us money, basically. We want to help you, but you have to pay us money. And we got Cuba over here saying, we'll trade you vaccines that we made for some food that you have so we can feed our people, because we can't get any other goods because the United States blocks us from getting food for our people. So that's enough about this topic. Yeah, thanks for showing up. Quiet day today. Quiet day today. Maybe it's because of the title of this video. Very likely. So let me go to this other story real quick. So this one's on a modern day slavery operation uncovered. Thousands of migrants exploited in South Georgia. For years, Mexican and Central American laborers have been brought to the U.S. to work on Georgia farms as modern day slaves. About 24 human traffickers who were part of the crime ring that enslaved the workers are all facing felony charges, which include mail fraud and mail fraud conspiracy, forced labor and forced labor conspiracy, money laundering, and witness tampering. The U.S. Attorney's Office believes that this case is one of the country's biggest human trafficking and visa fraud investigations. The investigators uncovered inhumane living conditions such as filth, cramped space, and little access to safe water and food. 2 workers died while the others were kidnapped and raped repeatedly. While the migrants worked in Georgia's farms as contract laborers, some of them dug onions with their bare hands for just 20 pennies per bucket while being threatened with guns. The traffickers also took away their passports and legal documents to keep them from escaping. The migrants were forced to pay unlawful fees they couldn't afford, as well as forced to do extra work such as construction, and were threatened with violence and deportation. The traffickers made more than $200 million from selling and trading migrants to other traffickers. David Estes, U.S. Attorney for the Southern District of Georgia, said in a statement, "Thanks to outstanding work from our law enforcement partners, Operation Blooming Onion, Operation Blooming Onion freed more than 100 individuals from the shackles of modern day slavery and will hold account those who put them in chains. Now, I saw this on Latinovations. This is not new. This is not a one-time thing. There's this book actually that I read many years ago called Tomatoland that kind of exposed this issue. This happens all over the place. In this specific book, there's accounts of farmers in Florida, tomato farmers in particular, being forced with the same tactics of, we're going to take your papers, we're going to pay you pennies, you owe us money for like high rent to live in these like shack situations, no water, no food. If you say anything, we're going to like, do harm to you. So this happens all the time. This isn't a one-time thing. I'm glad that that Operation Blooming Onion, it was a success. But this is just one state. This happens everywhere. I would highly encourage you to read Tomatoland if you want to learn about basically slavery and in farming. So this is one of those things that makes you think like, vegans talk about, oh, we, go vegan, don't harm any animals, but who's picking the tomatoes, who's picking the lettuce, who's picking the radishes, who's picking all this stuff that you enjoy. So, vegans aren't as, when they preach to you about not harming people, make sure that they understand, do you know where your food is coming from? And do you know who's picking that food? And do you know who's literally in slavery to pick that food for you? So that's all I wanted to say on that. And I am going to go try to keep this stream kind of short, 37 minutes. Thank you for watching. Hopefully it provided some information to you about Cuban jabs and how vaccine apartheid is only a thing in the capitalist society. Because Cuba is an example of it sharing its vaccinations to the world for free, for literal food in exchange for food to feed its own people. And talking about food, remember where your food comes from. Always question where it's grown, who picked it, and what practices are those farmers doing. Respect your farm worker. That's all. Have a great Thursday.